Hey, this is Jorge André Cardoso, and I would like to invite you for a webinar on teledentistry. That's right, how far can we go with teledentistry? Obviously, dentistry is essentially a hands-on practice with the patient face-to-face. But how about digital appointments, distance management of the patient, early diagnosis and prevention? How about reducing and optimizing the time for the patient actually being in the office? What is possible today? Is it useful? Is it worth it? Is it ethical? Is this just a trend due to the limitations that we have today? Or is it something that is here to stay? How about patients? Are they into this? And dentists, are they ready for this? Are they even interested in this? In order to answer these questions, we will be interviewing Dr. Aalok Shukla. Aalok has a background in private practice, and over the last 5 years, he has been pushing boundaries in teledentistry projects based on what he calls dental wellness. So feel welcome to join us to chat about how this can change the way that we practice and the way that patients perceive dentistry worldwide.
Okay, so good afternoon to you all. First of all, I would like to welcome you and thank you for such huge interest in this topic. I'm going to let Alessandro Devigus do the introduction. Alessandro, can you hear me?
Yes, I can hear you.
Okay. So you can start.
I can start. Okay. So I'm really happy to be with Jorge and Aalok. Jorge, I know you a while for some years now. Aalok is a new friend or a new face in my dental community, but a very interesting one. And teledentistry or digital dentistry, we can put it all together, is something that has a huge impact in our daily lives. And we really want what you have seen in this perfect introduction video by Jorge, what the questions are, what the problems are we need to discuss. And not only because of this actual situation we are facing, but this is something that will have a huge impact on the future of our profession. And I'm very happy to share with Jorge and Aalok and also with all participants this topic, and hope also that there are some questions that we can answer to find out what other colleagues are thinking about this. So, Jorge, thank you very much.
Thank you. So, Aalok, I'm going to ask you to share your screen, okay?
Perfect, sure.
I'm going to stop sharing mine, and you can share your screen.
Perfect, so just going to click sharing. Hi, everyone. Really looking forward to this discussion and connecting with more people. So can you see my screen?
Yes, we can see your screen. Perfect.
Perfect. Okay, great. So my name's Aalok. I'm co-founder of Uplift, and we've been focusing on digitizing dental care, basically making dental care and oral health accessible and affordable globally. And that's the main thing that we've been focused on.
So, Aalok, before anything, I would like to introduce you. Some of the people here already know a little bit of my story with you, but Aalok is one of the most influential people in my life, and in terms of, I don't think I would have had the same fulfillment on the profession. I wouldn't say success, because success is very relative, and the success for me is not the same as success for the others, but the fulfillment that I have in this profession has been quite a lot due to this very energetic guy and this very interesting character called Aalok. And he basically made me realize that whatever I wanted, I should go for it. And I never wanted to be a superstar dentist, but I had these very specific goals. And looking back now, I think that I've achieved most of them. And I have to thank Aalok for that. So Aalok has had a background in in private practice, and then he started some digital projects in teledentistry, and he has a business model that is based digitally that he calls dental wellness. That's what he calls it. And I think that it will be a very interesting discussion, because Aalok is someone who is very energetic in terms of his business goals and his business activity. And when I first noticed that Aalok was stopping his clinical practice and he was going to this direction, I thought, well, this guy is completely crazy. And the reason was because I consider myself to be a dental nerd. So the impact that I have on my profession is through my patients and eventually through my students. So that's a very limited impact. And then I realized that even though the path that Aalok was taking was a little bit outrageous because he wanted to do these huge topics, then I realized that the potential of impact that he would have on oral health globally was much, much bigger than anything that I would do on an individual basis. So I understand that in the beginning, it's difficult for a regular dentist to really accept the way that Aalok has really disrupting the dentistry. But I think that the potential for help in terms globally, I think it's very, very interesting. I think that we all, even that if we agree or we don't agree, we all have anything to learn, something to learn or to discuss or to ask Aalok. And Aalok is a very open-minded guy. I'm sure that you will all answer all your questions. Okay, so Alessandro, you can start with the questions.
Well, wow. What questions?
Okay.
No questions. So what?
Okay. It's
so far, no questions, or I don't see any questions.
Oh, no. Your question. Question number 3.
Okay. Okay. Sorry. So, okay. For all those who don't know me, I'm into digital dentistry for more than 30 years now. I was impacted, or my impact was when I was a student. The CEREC system was invented by Professor Merman, and he made one statement in one of his lectures that said the goal of what I'm inventing of this machine is to get dentists better with the help of a computer or some machine. So the combination of our hands and what we also say brain and hands, the brain could be then the machine, a computer, a CAD/CAM system, whatever can help you to become a better dentist and offer a better service to your patients. And so this is still my main focus in my work, to say, don't delegate too many things. Try to be with your patient, focused on your patient, and get the tools you need to be more efficient. And one of those tools, certainly for the future, is to get contact with your patient before they sit on the chair. Because chair time is often inefficient and expensive. So when you can select what you have to do, when you find out what you have to do, you can be much more efficient when the patient is sitting on your chair for 30 minutes, 1 hour, then you work this 1 hour and you get a better result, a more happy patient, and not spend 30 minutes to ask the patient what his problems are. So we need to do this shift and use more technology to collect information. It's not big data like in other professions, but collect information, as much information as possible, to be efficient and prepare yourself before you treat. And maybe you find out when you prepare yourself with a lot of information that you don't need to do any treatment. So this is my history on digital dentistry, which continues. Digital dentistry today is a big hype. Everybody now is a digital dentist, but we really have to find out what are the key instruments, the key tools, and talking, or this discussion with Aalok today is certainly something very important for the future of our profession. So, yes.
Okay, so Aalok, what do you think in terms globally? How can digital dentistry and teledentistry have a big impact on improved dental care globally. What do you think about that?
Okay, great. So first of all, thank you very much for the opportunity to discuss with everybody. I think the way we see things is about augmenting dentists. Okay, I think that's the most important thing. Dentists are very trained professionals. They care about their patients and they really want to help as many people as they can. If we think about the world, in the world is undiagnosed and untreated. We have 2 million dentists, nearly 8 billion people. Most people have some form of gum disease, most people have some form of tooth decay, and these things are progressing and getting worse and leading to bigger problems. A lot of people are also scared of the dentist. Less than 50% of people visit a dentist. So really, it's about helping more people access it. So I think the key thing about technology these days, and this is beyond COVID, it's helping them augment and connect professionally with their patients so they can actually prevent things and also look after the ones they really need to see.
So, Alok, do you think that we know that this is a scary and uncertain time for dentists and dentistry? So even if everything returns to normal, this is highly likely that the population will be more skeptical for in-office treatments. I'm sure that you agree with that. Do you think that teledentistry will still be used after this COVID thing? Do you think this is just a trend? Or do you think that this is something that is here to stay? What do you think?
So let's zoom out a little bit and let's think about telemedicine as a whole and teledentistry as a specialization of medicine, okay? So if we think as a world, people are living longer, people are more active and more busy. There's very great advances already happening, say with teleophthalmology, remote eye screening, teledermatology, checking precancerous lesions, monitoring different issues, telemedicine for GPs, you even have telesurgery. So within the context of the world, we are looking at digitization of health. It's very common. And these days, with COVID, it's simply a catalyst to accelerate what's going on. But I think the fundamental thing we have to understand as a dentist is dental conditions are diagnosed visually and volumetrically. So you're able to understand different changes that are happening within the pathology, and you need to just start to understand how to read a photograph or read a video like you read an X-ray. So forget COVID, this is here to stay, and it's simply a question of how you can engage with more people to, make it as accessible as possible, really.
So, for example, in my personal opinion, I've been doing a lot of dental education through webinars. And in the beginning, I was quite skeptical because we would not maintain the energy. And what we realize now with students and even meetings between practices is that we will do more and more, even after COVID, we will do more and more webinars. There's someone here with the muting. Okay, I'm sorry for this. Okay?
No problem.
Now, so I was talking that I think that for the experience that I have, even the meetings and everything, I think that the webinars can actually, and doing things remotely, you can maintain quite a good level of energy. I think it's very interesting. Okay, Alessandro, so we have question number 5. I'm going to unmute you.
Okay, so what is possible in teledentistry? So again, I think this is a very important additional tool. So we have to be careful. This is not a WhatsApp call or a FaceTime call you do with your dentist or your doctor. We will come to that later. This has legal issues. So be careful and don't use just your social media channels to talk to your patients and give advice on social media. Important in teledentistry is that this is closed, that this is safe, that data communication is and this is also an issue patients are asking me. So if I send my data or if I put my data on this website, is this safe? Does anybody else can see my information? So this is these are the questions that patients are asking, and so we have to be careful to separate what you are doing with your children, what we are doing with our grandchild, that we do some FaceTime and hello, and doing something serious. So this has been then, and Alok will show us, this has a defined strategy. There, the questions are defined, so it has a protocol. It's the same protocol that you use if you visit the patient. So what are the steps you need to do to collect data, then to make the interpretation of the data, and then to find the solution. So basically, teledentistry is the same that you are doing, but you're preparing everything online, or let's say out of your office, and save time, because you can also say, okay, now I have collected all the information, I can sleep over it and take a look the other morning and then find what is the best solution for my patient. So I think this is very important. And important in this whole context is what George, what you are doing with your Make Me Clear, is that we add additional tools. Because if a patient is asking advice to one doctor, this doctor might not know the answer, or might be not the correct person to answer the question. So teledentistry should be part of a bigger network, with having even general doctors or dermatologists or other people, because maybe your patient is sending you an image, and you see he might have a pre-cancer on his lip. So then you say, look, I see something, and I'm doing this a lot with my patients, that I'm sending them away to other doctors. And this should be part of what we call the big diagnosis. So collecting information, analyzing the situation, and if you don't know how to analyze, find the right people to help you to get the right decision. So this is what I see, and collecting information digitally has to be on secure channels. So if a patient takes the phone, this is not secure per se, but if he sends it then into a system that is safe, then the whole process gets safe. And this is a very big concern for a lot of patients, because now you know, also with the COVID stuff, now they want to collect all our data, and a lot of people are afraid. Or our son was telling, look, if we will find the vaccine for COVID, they might also inject a chip under your skin, like they're doing with the dogs, and then this shows that you are vaccinated. But this also opens all the doors for taking control over us, you know. So this is the scary part of a lot of patients being afraid of sending or sharing too many informations.
No, and with teledentistry, if you think about it as a kind of whole, there's kind of like two main models. You can kind of like look at it from, say, dentist to dentist, or dentist to nurse, or dentist to therapist. That's one way you can use it. Or the other way is patient to dentist, which is probably the bigger focus that we're talking about, but they're both kind of equally applicable. And if you think about those two models, based on those two models, there's two different modalities you can use. Synchronous, which basically means live. So synchronous is like a video call, or it's a live chat. They're the same kind of images, but the perception is it's time bound. So there's an appointment. So you're copying what is in a clinic in terms of a time or appointment. The other type is asynchronous. So that is where someone is able to message, and it can be multimedia, and we can see what that looks like. And then the dentist can then review that independently. And I think what's very important is dentists are in professional practice. Professional practice means your time, your energy, your skill. So you need to manage that very efficiently and make sure you do it effectively. So as I say, synchronous teledentistry can be very helpful. Let's say you were going to a school, a dental nurse was doing a screening, and you were then helping guide different elements, or in a care home. Synchronous can be helpful. Asynchronous could also be helpful in the way that, like, the carer could capture all the information for all the different people, and then you can in one batch review everybody in one go. So technology really offers the opportunity to kind of augment what you're doing. And I think it's good to make things visual, so you can kind of like start to understand what that flow looks like. So our platform is asynchronous because it's the most efficient way for a practice to basically multiply and care for more patients. And it means that all patients go through a systematic effect. They are all asked the same questions. It's a consistent protocol. You capture photos, and video. So from the video, you're basically capturing, hundreds of photos. You can zoom in and see what's going on. And the dentist is able to communicate using a form of report. So you're not spending time on a video call and then typing everything up afterwards in your notes. You have everything documented in a place. And because it's episodic, you can also message, clarify, track how someone is going on, and move from there, really. I think that's becomes quite interesting what you can do. And you're able to actually do things in a multimedia way. So you can capture photos, information, clarify text. If you had a patient in the practice and they had toothache, you would ask, does it hurt on hot drinks? Well, you can do the same thing by clarifying, do cold drinks make it worse? So you have all the tools available to you in that way, shape or form, essentially.
Okay, so Aalok, I was reminding of something that I've heard Gary Vaynerchuk talking about, and he basically was in a conference and he asked the audience, how many of you actually get pissed off when someone calls you and they prefer that someone texts you? Because the new generations, they want to answer people in their own timing. So I don't want to, sometimes, and it happens to me, sometimes when someone calls me, I may eventually be physically available, but I'm just focusing something else. So this is sometimes, I think that with dentists, when we call people, we think that that synchronous option is something useful because we believe that people want to have a real conversation. Sometimes, yes, it's useful, but I think that people want to interact with platforms in there or with the dentist with their own timings. Okay.
Yes,
so
I agree with you. And you want to separate out two things: diagnosis and emotional reassurance, basically, right? So for emotional reassurance, obviously, a synchronous call can be good because you can kind of clarify and go through those things. But it can be very difficult to actually do data gathering to see what's kind of going on at specific clinical issues as well.
And also because younger generations, they are much more, of course, there are good and bad things, but they prefer to interact with an interface that it's automatized and actually to be speaking with someone. I mean, there are good things and bad things, obviously, but I think it's an interesting point of view because younger generations, they want more and more asynchronous contacts. They want to answer and they want to interact in their own terms. So the other question that I have to you is, so I would really like you to be really specific here. I'm gonna put you three scenarios, okay? So one thing is new patients, someone who has never had any contact with the clinic, okay? And this new patient, you have two options. Option A is he wants to have an opinion, and option B, he has a specific problem. And then there's a second patient, which is a patient that is already your patient. Yeah. And how do you think that platforms like yours or some other platforms, how do you think that they can interact with these three different situations? Number one, new patient for an opinion. Number two, new patient for an emergency or with a problem. And number three, a patient that already is in your practice. Give me three examples.
Sure. So in a new patient, it's exactly what I just showed you here. Basically, they would do a dental health assessment, answering different questions, putting photos into the system and clarifying what their dental history was in the past, what procedures they've had done in the past, if they're interested in improving their smile, happy with the color of their teeth, if they're interested in long-term focus, or and all those different elements. And what we've done is we've created something called a 360 smile analysis. And what that does is it assesses across 22 different dimensions from biology, structure, function, position, shape, and color, your enamel thickness, your gum biotype, all these different elements are all analyzed. And then the dentist can annotate and explain what's going on. So the whole purpose here is a new patient is educated. They also are done it in a way that they don't feel pressured to have to accept something right now. And they can also ask questions about, hey, I thought I had good gums. What's this recession? Or, for example, I have cracks on my back teeth. Can I do something about that? It gives a kind of impartial way to kind of interact with the patient there. Second scenario you were talking about was like specific concerns. So
sorry, Aalok, to interrupt you. Sorry. So basically what you are saying that some patients, they are actually not very confident of talking to someone or going to the office. They are like embarrassed and they want to have like a more safer, less exposed approach. You can say that.
100%, because what you're doing is you're taking away the kind of personality the pressure of it, basically, right? You're moving to kind of like explaining to the person what's kind of going on. And there's many people that are nervous, and people like to have the information, and they can choose from that information that, okay, I want to schedule for, these 2 fillings of this onlay at the same time, because they can be pre-educated in this way. The other scenario that you had was like where you had someone with a specific concern. So there's another type of consult which is similar to this, but then it just asks you more questions about that particular problem. And what you're able to then do is clarify and focus in on that problem. Well, if you're asking about how you would then see somebody for a review, so for example, specific problem here, this person on the tongue had an issue and she was getting quite nervous and quite anxious because she was searching Google. Google is not your friend if you've got a problem. If you think you've got a problem, Google is not your friend. Like you suddenly think you've got everything, right? Like, so that's like a thing. And then what you're able to do is monitor soft tissue lesions. So you can actually then get them to photograph it regularly and see over 2 weeks as it changed. And you've got that perfect history of how it was. Same thing with a broken tooth. If someone's chipped something, you can give clarification and reassurance in that way. Answering your question about existing patients. So let's say you were partway through treatment with somebody and you just fitted a crown or something and you want to get them in for an adjustment or a review. Well, this way, what you could actually do is you could actually then do a digital review, and you could do it through a specific consult where you could actually say, I'd like to see how this crown is now, or I'd like to kind of see how you're getting on with your new or implant prosthesis. Can you do 55, 65, 75? Can you say 66, 67? Whatever you want to check, right? Because if someone's got these issues, you can do this, and you can also then quantify that because you've got that video stored, and you could be like, okay, your phonetics have improved, so you can actually then quantify that over time. So you've got the complete flexibility in that shape.
So you also, when we were talking a few months back, you also told me, like, for example, you were giving me this example, which I found very interesting. Like, say I have a patient who is coming every 6 months for the hygienist, and someone like 2 weeks before makes a digital appointment with them and asks, so can you send us some photos to see what's going on? So instead of booking only with the hygienist, you prepare ahead, and what you do is that you will optimize the time, because there will also be a restorative procedure that you have to do. And you can also optimize your time, because sometimes you are booked for the hygienist and the patient has a broken tooth and the patient wants to treat it at the same time, and it's not possible because they don't have the schedule. So if you prepare things beforehand, you are actually optimizing the time of the patient and yourself at the clinic, because you are prepared for what you're going to see.
Completely. So let's think about it, right? So let's say a 30-minute appointment was scheduled, or 40-minute appointment for hygiene. If someone's done a digital pre-screen and they've had their checkup, digital screen beforehand, and you see that there's 3 restorations, 3 small fissures that need to be sealed, okay? Now, if you saw the patient just for the first time and did the hygiene, and then you were thinking, should I mention it? Should I not mention it? Or shall we do it now? Suddenly the patient didn't know about this, right? They did not agree for this. They just came in for their hygiene, and then they feel a bit anxious. So the time is not actually the restorations. It might take you 5 minutes, 10 minutes or whatever just to do those restorations. But if beforehand you did a screen and say, hey, we're going to do a digital pre-screen to see if there's anything else we can help you with in the office, then if they do that, and then you say, actually, there's these 3 small areas, would you like them taken care of tomorrow? And they're like, yes, I would. You've suddenly kind of made that appointment much more productive. And I think these days, if post-COVID, you're going to have to wear more outfits and take more time in between patients, you really need to make sure that each appointment counts, because they don't want to come when they don't need to.
Oh, interesting. So, Alessandro, you can go question number 7.
So basically, I'm new in the system that Aalok is presenting. So my history of teledentistry is emailing with my patients. And I told you in the beginning, I was the first dentist in Switzerland having a website back in 1994. And already then, the email communication started. So it's interesting that we get a lot of emails from our patients. So basically, I'm already now doing this, but not in a controlled way. So some questions are very short with some photos attached. Some are writing long histories, and you don't understand what they exactly want to say. But I think that using a tool that has guidelines that leads the patient through some steps makes the communication with the patient much more efficient and more standardized, because otherwise now I get emails every day. So I can tell you I'm in constant communication We are also sending out newsletters to our patient. I send out one. We have, I don't have all of our patients in my mailing list, but it's more than 2,000 that are receiving our emails. And after sending this, I got so many calls in my office, you cannot imagine. And I got a call from an assistant from a patient that was saying, yeah, my boss told me that this morning there was a newsletter coming from Dr. Devigus. I have to call you to fix an appointment. So communication between you and your patient is important, but if it's through email, it takes a lot of time. So it blocks a lot of resources, and they want to talk to myself. It's not that I don't trust my assistants, my girls, they're doing a great job, but the patient wants answers from the doctor. And so I think starting to get people from the old channel to a new channel of communication is very important. And I'm sure that a lot of colleagues around the world are now communicating. And the worst is if you start communicating through WhatsApp or SMS, because then it never stops. Then it never stops.
No, and patients want this, right? If you think about it, they want reassurance. They want to understand what's going on. Even things that you wouldn't think as an emergency. Like, for example, there's somebody had messaged in that they had a problem and they were concerned that some blueberry skin had got stuck underneath the gum. And it sounds innocuous, actually. But if you actually look at the details, she's probably got ANUG. She's probably just like suddenly lost became quite inflamed and infected. And so you're able to actually advise and guide somebody remotely to improve their home care, because home care is a massive part of overall dental health. So patients are so totally ready for this. They're already experiencing telemedicine in other areas of their life. And what they're looking for is the practices that are able to kind of support and help them in that way, really. If we think about the way teledentistry and mobile dentistry fits together, it's good to think of a wellness model, okay? So let's start from the left-hand side where we have perfect dentition. And then on the right-hand side, can you see my full right-hand side?
Aalok, sorry, can you just go back to the other slide? Because I'm sure, how many clients remotely or patients do you think that your business have over the last years have interacted with? I'd say thousands, right?
Yes, correct, yes.
So what's the feedback of patients? Are they skeptical? Are they looking for trust? Or
the main thing they want is proper answers. Everyone has a unique situation, so they want a proper answer on their situation. Like generic information is not good enough, right? And it depends is not good enough either. So if they're able to take a photo and highlight the area that they have a problem, and then they can get a proper answer back, with clarifying a couple of points before doing that, they're very happy. Also, the fact that consultation is stored. They can access that anytime. That opinion is there, it's locked. Medically, legally, you're protected because you've already explained to the person what's going on. They like this because it's trust, right? It's making it transparent in that way.
So do you think that the typical patients that you receive are people which are uneducated and see this as a low-cost solution, or are actually people that really want to look for that? So those are people that they have the same demands of quality and trust as if they would go to a normal dental office. What do you think?
Yes. Basically, someone who doesn't care about their teeth doesn't care about their teeth, okay? But somebody who does care about their teeth is about it a lot. And the thing is, if you do some procedures like you whiten your teeth or you straighten your teeth, you care about it even more. There are people that become almost like super users, right? Like they're just interested in everything. So what we find in the profile is it's people that can't access, or people that are nervous, or people that want a second opinion, everybody. But these days, everybody's interacting with the whole world digitally from everything else, right? Dentistry is just not connected into it, or wasn't until now, but it's completely normal in all the different elements. And people want to prevent things getting worse, right? People want to be able to take their role and be a partner, because they're a partner in their oral health. And as I was just kind of mentioning in this kind of model, basically, if we think perfect dentition on the left and then destroyed dentition on the right, we have risks. So, for example, there's a reversible zone on the left where things could be reversed, and you have a management zone where it requires treatment. And the thing is, you can start to identify who has risks in what area. Is it risk of cracking teeth? Is it risk of gum disease? Risk of decay? Has somebody appeared to have a risk acceleration? is the gum getting a lot worse quicker? Is the tooth wear getting a lot worse quicker relative to the age? Is the, all these different elements of biological damage. Is there now like a crack and also decay around it? You can spot all this visually. And so the whole point of this is to take your practice from a reactive model and intermittent to a proactive and continuous model, basically, right? So you can look up.
Aalok, I was discussing with Alessandro Devigus, and Devigus was telling me that one of his very influential professors in universities was saying something like, the goal of dentists is that they are not needed anymore. So I'm sure that in North Europe and Switzerland, people are much more into prevention than in other countries like Portugal and eventually Spain and Italy. But Alessandro, I understood that one of the things that really got attracted you into teledentistry is the fact that you can really optimize prevention. Do you want to talk about something about that?
Yeah, I'm sure that we need to get more prevention and reduce the cost of prevention. If I do prevention in my office in Switzerland, the 1 hour of dental hygienist is 200 Swiss francs. And if she spends 30 minutes talking to the patient or explaining how to brush his teeth and so on, for many patients they don't want to pay for that, or they don't feel comfortable. But if we give them more information beforehand, we can avoid discussions in the office. So also, since I'm using Make Me Clear and get better information in a readable format for the patient, I have much less discussion. So because you can, it's like I have a lab technician. And in Switzerland, we have a special education that you can also take impressions. So they can do full dentures, not being a dentist.
Yes.
They do full dentures, they repair dentures, and one is working below me. So sometimes an old patient goes down with a broken denture or a problem, and he explained to the patient what he needs to ask the dentist, and it's just one stare up. He comes in 30 seconds later, he stays in the office and he doesn't know what to ask us because he did not understand what the lab technician was telling him. So this is important that we collect information and that the patient understands, so that the communication is on a good level.
And your practice is a prevention-centered practice, correct?
Yes, I'm the only dentist, and I have 4 dental hygienists. So we are offering a lot of service. So I'm working, and I think this is also the future. We talked about this, the future of dentistry. I'm not convinced that big dental clinics or big dental centers are the future for our profession. We can have a lot of patients monitored using teledentistry. So you can even as one dentist have 10,000 or 20,000 patients. At the end, you treat maybe 1,500 or 2,000 really physically in your office. So this for me
very interesting.
Is the future. And what I'm doing then is high quality. So I want to focus on quality. And the other concepts of the big clinics is mass production, and dentistry is not scalable like iPhones or software or anything else or toilet paper.
Agree.
So this is the thing. We have to keep the quality of what we are doing, because if you can do high quality work, it's more fun. You are more satisfied with it, rather than just pulling out 2,000 teeth a day and at $5 each. So this is not the future. And combining the technology with what we can do or what we also like to do, I think this is the perfect match to get a high quality education of our patient, and at the end also high quality treatment of our patient. And then they are more, and then they accept what we are doing and they are happier.
And you can also layer on onto teledentistry, not just diagnostics. You can also layer on at home or supervised care with treatment. So there's, for example, for say gum health, there's different regimes, or say for erosion trays with some kind of like remineralization agent. For, you know, like for sensitivities, the same thing, or for whitening. So you can start to layer on 0-visit treatments and 1-visit treatments as part of your prevention. So the practice of the future would basically have a massive population it's looking after. And when it has clinics, appointments, it would focus on like 1-visit things like CAD/CAM or whatever, so people don't need to come back and do the full quadrant. And then otherwise, all the review appointments are done digitally, right? Because then you've got a track of how that is. So for sure, you've got those different elements. And I think the other way to kind of think about it is a spectrum. So if we think about how you would assess somebody, if we think of what comprehensive assessment involves, we have like a medical history, we have dental history, we have visual inspection, special tests, and x-rays, for example, right? So within that point, there's a continuum. This is not teledentistry or practice. It's a continuum, basically, right? So the whole point is, if you don't have a continuum, you're basically neglecting a lot of the information you could have, and you're not using your time efficiently. So if you think about like with teledentistry, you've got the ability to get questions, forms filled out, messaging to clarify perception, sensation, aggregating factors, goals. Visual inspection can be done digitally, extraoral facial analysis, pre-screening of like the kind of gross macro elements of the teeth. Bite function analysis, you can get them to do guidance and see what's going on, cosmetic analysis. All this stuff can be done remotely. You can even layer on, if you wanted to, let's say you were in a city and your patient was in a different city, you could refer them for an x-ray, right? And then they could upload their details onto the plan. So if you're treating people that travel from abroad to see you, they could put their, you know, x-rays on there, or even a 3D scan of their teeth. And then you can then arrange for them to get, you know, whatever appliance is required. But it's a continuum, essentially. And if you've got the right framework, you can build on that in sequences, basically.
Okay, so very interesting. So we talk so far, and we realize that patients really want to go into this, and prevention is really a central key here. Aalok, I would like to ask you, because when you first started in teledentistry projects, when you started, for example, with the aligners, I'm sure that you suffered from a lot of skepticism from dentists. Now we are not talking about patients. Let's talk about the dentists. Do you think that dentists are very skeptical? How was the reaction to that? Do you feel that the dental professionals, are they open to this? Do you think they have ethical concerns? How do you think, and how do you deal with the skepticism and the criticism of the dental profession, being you a dentist, or being you also a profession that work with that? Because in the beginning, when you were with your, and you still are with your Straight Teeth Direct project, many other companies, like the most known companies, they people that are doing some of the diagnostics are not even dentists, right? And in your business, you are working with dentists, right?
100%.
So number one, how was it frustrating for you to create a business that was trying to empower dentists and being criticized by dentists? And how do you think that dentists watch at these things?
So I think that, like, if you look at technology's impact over like all areas of our life, like it's made things more accessible, more affordable, from food, from healthcare, from transport, whatever it is, right? And I always thought that, like, you know, there's the equivalent that can be done inside dental care. So if you can augment dentists, so enhance them and give them communication tools so that they can kind of reach more people, they can be more impactful. I always think it's a shame, if you think about the percentage of people with a condition and the percentage of people that get treatment, if there's a huge disparity in those two things, then why is that? And then, for example, with teeth straightening, it's cost, for example, and access. So when we started Straight Teeth Direct, like we were focused on like, how can we help dentists remotely monitor, remotely treat their patients, and at the same time make it affordable and accessible for more people to do so. But it's important to understand that dentistry is complicated. You need to do a consultation, then you need to then have a report, you need to understand everything, you need to then gain consent. So we built a system which basically allows all of that, and it's completely screened and monitored by real dentists and real orthodontists. We manufacture aligners ourselves, send them in stages and all this stuff, so we do the refinements. So I think from our perspective, we have customers in 61 countries. We see that, like, people just want access globally. And also what we found is we actually directed so many people to their dentist and say, get this done, go and get that done. And they previously were not motivated. So we've always been quite...
Sorry, Alok, just sorry to interrupt you. So it's interesting that in the beginning, this was seen with a lot of skepticism from the dental community. I'm not pro or against. I'm just trying to play the role of the skeptical dentist here.
Of course.
So, but what I see is that, for example, Invisalign now, they are doing this remotely. That's what they are doing this. But in the beginning, and there are not even dentists doing the clean checks and stuff like that. But in the beginning, when you were doing this was outrageous to dentists, wasn't it? But then I asked you, which kinds of dentists and orthodontists are working in your platform? And I thought, well, these were like the lousiest orthodontists, people that don't have any work elsewhere, and they just go to this platform. But you told me that actually the orthodontists that work with you are quite different, right?
They're the most advanced ones. They actually have like state-of-the-art clinics. They have like all the latest equipment. They're just very passionate to like be relevant digitally in the digital age. So they're offering like very high quality treatments in clinic, but they see this as a way to reach more patients that would never otherwise visit them.
So the way that you gather dentists, so basically you would contact the ones that you saw that would be probably more prepared for this. And you saw that the biggest interest was in the most successful orthodontists, the most experienced ones, right?
Correct. Well, if you think about Continuum, like Alessandro was saying, he had a website in 1994. So 1994 to think like, I want to have a website, and then you were like one of the biggest CEREC users, like you saw that there's a massive, way to help more patients that way. You always have a class of people that are just pioneering and just looking to kind of do the best they can and help the most. You see, if you look at medicine as a whole, you have so much. You have like, for example, so much going on in telemedicine. You have like remote diabetic treatment. You have like also people that are helping with like all sorts of different elements. So you always have like doctors that want to expand and help more patients essentially. And technology is just a vehicle to do that.
No, the discussion there is, what is a typical dentist?
So
the typical dentist is a person sitting in his office and working just by himself with the patient. And we know that a lot of dentists suffer from depression, even because the only thing they say is, rinse please, does it hurt? So these are the two phrases the dentists continue to say. And then that's the same like the ice bear in the zoo, walking from one side to the other the whole day and getting mad. So dentists should, and this is what I told my wife when I opened my office, don't think that I just stay in my office and drill teeth because I will get bored after 2 weeks. So you should open your horizon and look into new things and don't just walk straight. And this is my message for my whole lifetime. And also, if young dentists are coming to my office, too many young dentists think, okay, now I'm 25, I have finished university, now I want to make big money. I say, no, come on. You need to move, you need to find what you want, you need to find out much more. You're still learning. And I'm looking at my restorations, and I want to say that what I'm doing now is better than what I have done when I was a student. So stay open and open yourself and open your practice. So teledentistry, using this tool, opens up also your mind. I'm sure that the average dentist is afraid using these tools because he's afraid to talk too much to his patients. So this is something that you have to keep in mind, because I tell you again, rinse please, does it hurt, is it okay? These are the three phrases that the dentist is repeating the whole day. Or he comes to the desk and telling Mrs. Miller, please give the next appointment to my patient. So, and we have to break out of this and find new ways of communication with our patients, because as you stated, they are looking for that, they want that.
They will go to the place that is digitally enhanced, right? So the question is, if you don't want to go that way, then they might seek out a practice that makes it more convenient for them. It's simple as that, right?
On the other hand, Alessandro, he was talking to us about the experience of the regulations. Do you want to talk a little bit about that, Alessandro, regulations?
Yeah, I have faced these problems in Switzerland, especially because I was very passionate and was I already have put the service on my website, but did not send out an email to my patients advertising the service because I got an email from the lawyer of the canton of Zurich telling me, no, Dr. Devigus, you're not allowed to do this because there's a regulation from 2006 that a doctor or a dentist is only allowed to treat patients face to face. And I'm telling, and then my reply was, yeah, but I'm not treating patients when I see that. Yeah, but look, it's written there, no WhatsApp, no FaceTime, nothing. And then I was answering, look, okay, we have to look into these regulations because we need to change them. There's a need to change that.
There's many telemedicine companies. There's many telemedicine companies.
Yeah, but you know, in many countries, there are regulations that are 200-year-old, and if nobody asks to change them, they're still there. And if it goes to court, they say, look, this is this regulation from 1850, and this is still valid. So basically, we have to tell them also, the authorities, look, we want to change. We have a better communication, a more efficient treatment. We will save money for the community. We will save a lot of things, time, so people don't have to leave their work to get information from the dentist. So there's a lot of benefits. And I answered then, okay, I'm basically not treating the patients. I'm doing the same I'm doing for many years now by email. And using this tool, I'm doing it even on a more secure way than sending emails back and forth, you know. So this is the things. But if you start using this, I advise everybody to ask the local authorities, look, what are the regulations in my country, in my region regarding this technology? And I will motivate a lot of colleagues to go and ask them, hey, look, if this is still blocked, we need to unblock it because it has so many benefits, and the benefits outweigh all the downside of using these services.
Agree. So, for example,
I think that what Alessandro is doing, because for people that are listening to us that have eventually some political role or have some dental health role, I think that the way that they should approach authorities is say, look, this in terms of community health, this has the potential to improve the oral health and save money to the governments.
Yeah, in the UK, you have NHSX. It's the digital organization which basically approves and states the data security standards for the NHS. And for example, in the UK, they said, Skype is perfectly fine. They said also that, Zoom or WhatsApp is possible as well. So they understand that like these things need to be used. And it's simply a question of like, when you're dealing with a patient, you act professionally, you write professionally. It's no different than you'd email somebody, right? Or you'd actually put things in a document in a structured way. So the simple thing is, most countries in the world, they all want this and they all are approving this. And especially with COVID these days, more and more things are having to be done remotely, basically.
Yes. I agree. Okay, so now, Aalok, can you tell me? Of course, that patients they feel more confident with this sort of interaction. What do you think is the percentage or the number of patients that once they interact through either Straight Teeth Direct, for example, how many patients have went into the Straight Teeth Direct and you have actually referred them to have some specific concerns that were dealt with in an in-office? So how many patients were referred from your platform to dentists and also from Instant Dentist? What is it something that is common? So sometimes you just want to refer the patient to the dentist because you understand there's a condition that needs to be done in the office.
Yeah, so like on both examples, so I think for pretty much everyone from like Straight Teeth Direct, we're encouraging them to visit their dentist and motivating them actually because they have so many things.
So basically, virtually every patient that interacts with you through Straight Teeth Direct, you encourage them to go to the dentist to have their oral screen?
They should have had it done beforehand. It's a condition, basically, that they need to have their health check and hygiene and everything. But what happens is they become even more aware of different things they want to kind of look after. Even afterwards, they want to get bonding done and, like replace restorations. They're much, much more motivated. For instant dentists, basically, once people know exactly what they need and they understand the role that they can do at home, they just want to schedule the appointment, basically, right? So that's why we're working with practices now where they can offer this to their own patients and help attract even new people as well. So
do you feel that satisfaction of, look, what we have sometimes done was to be able to grab someone that would not go to the dentist, and through this trustworthy interaction, you've made them go to the dentist?
Yeah, I mean, we're just trying to democratize access, right? Simple as that, right? Help everybody get what they should get. I mean, in 2020, everyone should be able to access healthy, a healthy smile. Like, why not? And it's just a part of our mission to kind of just make it super easy and convenient.
Let me tell you a story which I was discussing with Alessandro a few minutes back, and this is the story that I saw in the webinar of Christian Kochman. Christian Kochman, he was interviewing Luis Calici. Luis Calici was the younger associate of Atelier Oral. Atelier Oral was probably one of the most well-known clinics in Brazil and in the world. It is based in São Paulo. And basically their target was luxury clients, like movie stars, people with a very high social income. And once the crisis came in, they had this staff of 100 people, and they were not basically making any money. So it's basically, they were all and he was talking about that. They were all superstars, but the money in their pockets once they grew was completely taken away by the marketing machine that they had to do. And they were very transparent and very humble, and they said, look, we have to, because some of the clients realized, look, what we are paying here is not for the quality of the treatment, it's for the luxury of the massage and the foot massage. And because the market has changed, the world has changed, now they downsized the clinic, and the clinic is now 4 chairs. He was talking, it's now 4 chairs. And Christian Kochman was talking to him, so what's your strategy? And they said, well, we developed an app that serves like an Uber for dental labs, and we have downsized our clinic to only 4 chairs. And now they see that the best model for dentistry today is to have not a big organization, to have four dental chairs, that the owner dentist must be working there. And if there is an increase of patients, you don't increase the size of the space, you do more shifts. So that has to do a lot with the thing of the book of the exponential organizations, right? That if you want to grow, space is not the answer, but actually it is the optimization of time and digital technology. What do you think about that?
I agree. I think like you said, dentistry doesn't scale. It still takes the same time to do 1 crown to do 100 crowns, right? It doesn't become cheaper and quicker, right? You still got to kind of look at all the different elements from it. So I totally think that the dentists that are able to add that digital layer, do their pre-screening, pre-diagnosis, and schedule productive appointments so that you have more and more productive appointments, and do shifts, like you said, because if you're paying the rent for the clinic and you've got everything there, it could essentially be run, 7 days a week with different dentists work 3 days a week, or the mornings only, or morning and evening as you wish to do. And it just makes it super convenient, because then those people are able to then do their reviews where they need to.
So Alessandro, you are the editor of the International Journal of Aesthetic Dentistry. You are one of the early members of the European Academy of Aesthetic Dentistry. I mean, you are used to work and know to deal with all the dental superstars. And do you agree with me that the most profitable and the most financially stable situations are the most balanced, not megalomaniac projects? What do you think?
Absolutely. Okay, in the past, the superstars made a lot of money with the lecturing. So
yes.
dentistry.
But now everybody's lecturing.
Yeah, no, now nobody's lecturing anymore, because I'm on one side happy that Cirque du Soleil, Cirque du Soleil. Cirque du Soleil was dentistry was entering Cirque du Soleil, and that's a bad sign for our young colleagues. because showing off the stage who's the best, I want to learn. I want to exchange. I want to learn from failures. I want to improve myself. And I don't, it's in English, decadence, or I would say
decadence.
The decadence was now brutally stopped by a virus. I really have to tell you this. I was telling my friends when we were discussing, Europe, maybe also the rest of the world, is in a phase that was the Roman Empire before he was breaking down. So decadence, too much things, too much money, everything wanted to make big business. Everybody's
too much ego, too much ego.
And now this brings us a little bit back. What we should do, we should focus on ourselves and what our business is all about, to help our patients, to talk to our patients, to understand what they want. And dentistry is changing anyway. So now the superstars are 90% male. Dentistry is 90% female. So this is something that doesn't work together anymore. So in Switzerland, when I was a student, 20% girls, 80% men. Now 80% girls, 20% men. If you're young, you will say, wow, now I want to study dentistry because there's a lot of girls. But the thing is, no, I'm not a macho, but you know,
of course,
the image of our profession will change. And nothing against women, they are great. But the average woman is not working 100%. Because for biological reasons, they want to also have a family, and the treatment time of future dentists will not be 100%. So teledentistry and all this option will offer us possibilities to enhance these new models of how dentists will work in their offices. So office sharing, time sharing, optimizing chair times, sharing resources can be ideally managed by using these digital tools. So I can imagine in my office, for example, that I would have then in a few years 4 or 5 dentists sharing my office, collecting all the information, all the data beforehand, and then having a schedule, who is working when, on what chair, and doing what treatment, and you can optimize everything. So I think for me,
like a shareable economy.
Yes. So it's like the open office you have in big companies. So there's not if you go to so not everybody has his own room. So there's an open space, and this space is shared, but it has to be organized.
So Alessandro, again, like I was saying, because you have a lot of experience with probably some of the most well-known dentists of the world, do you think that for a young dentist that is being very well succeeded, that he has like 1-2 shares, what would be your advice to them if they want to open like this megalomaniac luxury-based like 10 shares facility? What would be your advice to them?
Well, today I would not do that. So because not everybody is Dr. Appa or these famous guys who have all the connections, who have so. But
sorry, Alok, sorry, Alessandro. But even the guys from Atelier Oral, they even talked about Michael Appa, and they asked him, "Look, Appa, what do you think about the?" He says, "Well, I do have an image of luxury, but my practice is not as big as you may think, and is extremely efficient. He doesn't believe in big facilities. Yeah. He believes in very efficient, small number of chairs, not huge number of chairs."
Absolutely, absolutely. If you spend more time with one patient, at the end you're more efficient. So my concept of chairside dentistry, patients are coming from far away, and they stay half a day, 1 day in my office. And at the end, you're more efficient, the patient feels better, and also economically, everything is much better than seeing 50 patients a day. So going back to quality is I think, the best advice to a young dentist. Try to learn from the best. So my advice to young dentists is call or email persons you think that they are doing a great job, and a lot of them are really offering also not only courses, but that you can stay there, and maybe you have also pay something or just get nothing for it. Like
Yes.
our younger son, he's working now in the Netherlands with a famous chef, and he's working 15 hours a day, and he earns 800 euros. So, but he goes there because he wants to learn. So this is the message for young people. Try to learn as much as possible. Get as much as possible information in your brain, because when you're young, you get all this information inside your brain, and use the tools and look for connections and look for networks. And I'm sure that dentistry will be more a network than today. It's single fighters in small offices, and they should open up and network with each other. And network and also with patients.
Yes, Alok, do you think that, because sometimes people may think, well, because of this digital technology in teledentistry, the profession of dentistry is in danger. There will be a lot of unemployment. Of course, that Yuval has talked a lot about that in his books, about the unemployment that's going to happen. And we know that many of the jobs, like being a driver or stuff like that, they will be severely affected. But what do you think about dentistry? What would be the best way that people can adapt to changes in dentistry? And if you think that teledentistry has a role there?
Yeah, of course. Like if we think about it, like dentist jobs are not in danger. The dentist's job is to help improve the oral health of their patients, right? So if we think about, we're going to think about what you're looking at in terms of prevention, education, referral, treatment. There's different things that you need to do as a dentist to kind of look after your patients. And all it is that offering digital assessments, reviews, and things like this, it's just an enhancement. It's just an augmentation of what you're already doing. It's never going to, people are still going to need to have their teeth replaced, restored, repaired. It's always going to be there, okay? That's not going to change. But what it's going to mean is that you can then help people with some things remotely. Some devices can be sent to them remotely. They can whiten their teeth at home. You can supervise digitally. You can then see them for their in-clinic appointment. You can then review their periodontal health afterwards. It's just a new model, and it's just about being more agile, essentially, in that way.
So, and also another thing, there's a huge part of the population that is not going to the dentist. Do you think that teledentistry can help we grab those?
Of course. So people that, like, for example, say you're disabled, okay? Say if you're elderly in a care home, there's horrendous neglect in care homes, right? Or say you're nervous, or you have you have young children and you can't take time off to kind of go. Teledentistry can help all these people access oral health. This is what it's about. It's about accessing, new patients and new ways. And then they would be very happy to come to the day dentist for half a day, get everything done. They never have to come back for a long time.
It's very interesting. Yes, but sorry, Alok, but before they gain the trust to go there, you have to develop a trust relationship with them remotely, right? Once Correct. They get this, now they know exactly what is the energy of the person that they will meet in the office.
No, I agree, but then it's easy. It's quite easy to do that digitally. We were offering digital assessments actually in our own clinic. I had a private practice in Southwest London from 2013. And we found that people were actually traveling quite far to us, even from Birmingham and Manchester, which is 100 miles away, basically, or even more. And I was quite shocked at that. And the thing is, people, and there's so many good dentists nearer to them, but people, if they build a relationship digitally and it's about, they feel connected and they feel that that's the right place, they're happy to travel, essentially. So all practices can expand beyond their geographic boundaries and connect with a whole new class of people.
So it's interesting what you are saying, because the basics, they still apply. You have to answer promptly. You have to be attentive. You have to show that you care. So instead of doing that in the office, you can actually optimize that at your own pace, using digital tools, right?
Correct.
Yeah, but again, something very important that I think is that I don't think that teledentistry is an authorization for you to be very cold with patients or very robotic.
No.
It's the opposite.
Correct. And we find that the dentists that actually work with us, they're all very empathetic. They're all very write in a very nice way. And there's also some tips and support we give on how to like write and phrase and do things in a positive way, basically, because it's not just about pointing out the problem. Yeah.
So basically, you also give some tips to your dentists that work in the platform on what's the best way to communicate with the patient to gain their trust and everything.
Yes, of course, because they're just not used to communicating in that way. But once you get used to it, it becomes very simple. And then, as I say,
sorry, we have a question here. I think, Alessandro, you were talking about this. Manuel Neves from Portugal is asking, is this the same for all countries, poor countries and rich countries? They have different realities. And you were telling me there's a very interesting article that you were explaining me that the realities from country to country are quite different, right? Can you explain a little bit about that?
Yes, reality is different and depends largely on the economy of a country and also on the density of dental services offered in a country. There was an interesting study in Canada, which is very similar to Switzerland. So patients have to pay 95% by themselves. And there was a relation between the density of dentists and the aggressivity of the dentist towards the patient. So a lot of competition creates very aggressive treatments. So everybody wants to make as much money as possible. Because if you have a patient, you have to take the most out of him. And interestingly, on the landscape where there's no competition, it was the same behavior. They try to get the most out of the patient because the patient has no alternative to ask for a second opinion. And also in this, teledentistry might be something interesting because also over the last years, I get more and more patients asking for a second advice. And especially, let's say, also in the region of Zurich, we have a lot of new clinics, large clinics, and they are really acting like this. They want to squeeze the patient. So if a patient comes in, they do the cone beam CT, they do everything, they do whatever is not necessary. And at the end, they say, look, you have 10 restorations, we need to do all crowns. And then patients are a little bit, oops, is this really fake? This is not serious. And these patients are then asking for a second advice. And platforms like this could be a solution to get
trust, to gain trust.
We get lots of people
sorry, Alok, let me rephrase also here the question. So let's say I am a typical Portuguese dentist, or from the south, or whatever, or from Spain or Italy, from I would say from southern countries where human connection is eventually more important, or let's say. What do you say? What would you say to dentists that are more skeptical of using these platforms in countries which are not as much digitally oriented? That's number one. And number two, so it was not by accident that you came to Lisbon because you are now living in Portugal. How do you see Portugal? How do you see the south, these countries, and are they into digital? Yes or no? Do you have a lot of clients from Portugal for straight direct and stuff? What do you think?
So I think that like general customers and general consumers worldwide are very digitally advanced, okay? So everyone's using smartphones for everything. So it's, they're ordering food, they're ordering transportation, booking flights, everything is done digitally. So I think the perception of many doctors in some countries is that people are not that advanced, maybe for healthcare, but actually they probably are, that people are using it a lot. Interestingly, Portugal's used as a communications test bed actually by many companies, like 5G was tested here first and many different things. So there's many people that know that in Portugal, people are quite advanced in that way. So I think in all countries, there'll be a percentage of population who have a smartphone, because essentially it's based on smartphone, right? If you've got a smartphone and internet connection, then you're already used to transacting with the world digitally in this way. And then you're likely to then want to engage in as many things as you possibly can that way. If you don't have a smartphone, then it would be limited, isn't it, in what you can actually achieve.
Okay, let me just talk about what I think is a very interesting topic, which is the Cascada Declaration. Okay, Aalok, can you just let me share my screen?
Of course. Let me just bring this.
Okay. So I'm just going to share the screen, and I'm going to talk about something which I find extremely interesting, which is an article that was written in 2017 by a few authors. Can you all see my screen? Yeah, can you see it, Alok?
Yeah, not yet.
Okay. Oh, okay. I think it's now.
Yep.
Can you see my screen now?
Yes.
Okay. So let me just open this. So this article, it was written in 2017. It's very interesting because it's not very nice to dentistry. Let me just reframe the situation. So despite, I'm just reading it, despite the current knowledge of causes of oral disease globally, people continue to experience significant levels of disease and disability. Although technological and scientific developments over the last 50 years have contributed to improvements in the quality of life for some, oral diseases continue to cause pain, infection, tooth loss, and misery for a vast number of people. While many in the middle and high-income countries have marked overall improvements in oral health inequalities, both between and within countries, are now a major problem. So, and the article is very harsh to dentistry. Basically what they say, and this was done by a group of university professors. They say that globally the profession has little direct impact on the scale of the problem. Clinical interventions account for only a small proportion of improvements in the health populations. And they go even further. They say that while there is no doubt that the intention of the profession is to improve health, commonly used treatment regimens for tooth decay like drillings and fillings, gum disease like sculling and polishing, they do not by themselves arrest or control the progression. Furthermore, filling teeth inevitably leads to a cycle of replacements of increasing size, ultimately shortening the life of the dentition. Dentists are paid or evaluated based upon the number of such procedures rather than establishing health. In the private sector, dentists are under constant pressure to assure adequate returns on investment. Frequently, this results in overtreatment. And this is the last sentence here. Dentistry is drifting, it seems, away from its task of prevention. The mouth has become dissociated from the body, just as oral health care has become separated from general medicine. I think this is a very serious accusation towards dentistry, but we all know that this is true. But this should shame us all. How do you think that teledentistry, and because what happens is that digital technology has had the potential to balance inequalities for almost everything, like, for example, 3D printing. How do you think that teledentistry can help in prevention? Can you share your screen?
Yep, so let me share. Here we go.
Because basically what this statement says is that we have been completely not successful because we have been on the mercy of the dental industry and of the financial investment rather than being driven by providing health to our patients. And this is a very serious accusation because they think that dentistry should be a part of medicine, and dentistry has completely drifted away from medicine, which is something that should shame us all. What do you think about that?
So I think that this is all about prevention and preventing things before someone gets to biological and physical damage, basically. So by being able to identify risks early on and spotting and screening and offering preventive health advice, you can help people kind of make those things kind of happen in a positive way. It's very, very important. I think through this, you can actually be beyond the clinic and help your patients when they're not in your clinic, because people are in your clinic for a very limited amount of time, right? You can do a procedure or a treatment, but you can't actually provide guidance. And so through this, you can actually look after people in a much more structured way. And some people are asking questions about, is it GDPR compliant? Of course it is, because the patient is able to consent to what they're using. Their records are securely accessible. They can access them at any time, basically.
Yeah, I'm sure that these privacy statements and stuff, I think but what I realized is when you started to develop this technology, I was thinking about myself, no, I am doing a better job because I'm being in the office doing exactly high quality dentistry, but the amount of people that I can influence is very limited. I can influence my patients, I can influence my students to influence their patients. But the potential with these sorts of technology, that you have the potential to actually do something that is meaningful for people and not for the ego of dentists, which is what I do sometimes. Because if I want to take pictures, this is it.
Well, I mean, it's just a way to help more patients, right? And ultimately be efficient. So you're seeing the people that you should see when you see them, and the people that you don't need to see yet, you can pre-educate and pre-organize and go from there. It's just being more effective, really, to look after your patients.
So, Alessandro, you're also talking about one of the advantages of using these kinds of platforms is that it's more professional when you have to charge a patient, because if someone calls you and if you do a WhatsApp consultation, it feels very awkward to charge them, because our services, we are professionals and we should charge our service. I mean, teledentistry is not something to do for free, because that's the worst thing that you can do. So if you do it through WhatsApp, and I was talking to some pediatricians in Portugal, and they say, well, I have these patients in my appointment, and then they call me at 3 a.m. in the morning because their kid has a fever, everything, and it becomes a mess because there is no limit. It's unscalable, of course. And Alessandro, do you find that being paid through these platforms makes things more professional, more transparent, and also there's more justice in this? What do you think, Alessandro?
Absolutely. We need to charge. It's interesting that depending on the profession, people are ready to pay for a service or not. So if you go to a doctor in Switzerland, or even call a doctor, you will receive an invoice for that, for phone consultation over the phone, or if you go to a lawyer, then he will charge for that. And other professions, like a lot of craftsmen, like the carpenters or so, they come to your house and they measure everything and they tell you, they make you an offer, and you expect that this is for free. And in dentistry, people we are more like the carpenters or other professions, that people expect that we give them advice for free, or that we give them information on the phone for free. We have the position to charge, but if we put this position on an invoice, they would call us and say, why did you charge me 50 euros just for calling you? But and then they don't listen if you say, look, I spent 1 hour with you on the phone. They don't care. So it's better to lead them through a service and say, okay, you have to pay for this because this is a professional service. And you can, on the other hand, decide by yourself if you want to give this 20 euros as a discount to the patient if he decides to do a treatment. At the end, it's always the calculation. Some patients, they call you to save 5 euros, and others, they don't care what they spend. But basically, nothing, it's a saying, what's for free is worth nothing.
No, and as a professional, you should be valued for your diagnostic opinion and expertise. And so through this, literally the patients are paying for that. And so that's how you build and differentiate your practice, with how comprehensively you can explain and see what's going on for the patient.
Aalok, I was seeing that on your website, your next move is doing some sort of remote device that you can actually collect data. Can you talk us about that?
Sure.
So this seems like a medical device or something. But I was talking with a colleague of ours a few weeks ago that this prevention-driven medicine is also affecting the way that insurances, that they do their own plans. For example, they have like a medical device that they can use, and if the medical device detects that they are not eating well, or they are smoking, or that they are not exercising, their insurance plan is more expensive.
Correct.
So do you think that this sort of strategy that is really being used and more by insurance companies because they want to save money, that's it, that's basically that. Do you think that this will eventually reach dentistry? And do you think that this solution that you were talking about, do you think that this is, how far are we from this? 10 years, 20 years? Do you think it's closer than that?
Months, probably. I think if you think about, so let's look at two things. Insurance companies are already looking at how they can classify risk. They already do things like pre-existing conditions can't be covered and things, but they have to be quite brutal in what they do, so they actually can't help as many people as what they can. With this device, this is basically a dental scope. It's a Wi-Fi intraoral camera, and the patient can then see fissure level details. You can record video, photos, and then this all goes into the portal, which you can then document and see over time. So what this allows you to do is then see any hard to reach area. It's illuminated. We have them. We're looking to kind of launch them later on this year, basically, as part of a digital dental plan for patients, and then they can kind of join.
So what would be how would exactly would this work? How would this work?
The patient would subscribe to them like a digital dental plan. It could be through the practice or it could be directly through us. And what they would get is they'd get the camera, potentially a toothbrush with 4 brush heads. So that's like their plan, basically. And they would also get 2 digital screenings a year and then a discount on either products or treatments at home. So what that, treatments in clinic rather. So what that means is that they're able to monitor their health. And at the same time, if they want to add family members, they can do that. And you've got like, if a dentist is using intraoral camera, they understand how well you can see everything, right? When I had a practice, we used to have like a spa bed and a TV on the ceiling, and I would show them a visual exam as they were looking at the screen, right? And you could explain what's going on. So with this, you can do it completely remotely. One thing that we've started to do is actually going to be offering that through pharmacies as well. So around 3 to 5% of revenues in a pharmacy come from dental products, basically. So there's like thousands, or if not millions, of people that have dental problems that they're going to pharmacies. So it's a way for them to actually get dental assessment potentially through the pharmacy, and they can be connected to a digitally advanced practice, because then they can kind of go to them.
Are you aware that most dentists, that when you talk to them about this, they would completely laugh, like, so what are you doing? This is completely crazy. I'm sure that you are, because even for me, because I know you for many years, and because we talk so much about these things, now I start to understand. And once I see that the amount of people that you could actually move that were not going to the dentist, that you could actually make them go to the dentist, now I understand this. But for the dentist that sees the first time, he doesn't have the mental ability to understand this. How do you respond to that criticism and skepticism?
Well, it's simply
this, because I'm sure that this is recurrent, right? In your...
Sure. So I think that the key thing is that, like, I don't know, like how whatever it is, but like many people cannot imagine new things or see new possibilities. But for example, we've always found it's quite straightforward to do that, right? Like, and it's just this is already kind of reality. If you think about your Apple Watch, how many steps you track, that can be linked to your Vitality health insurance, and based off that, you can get reductions in your costs. And having this kind of assessment done remotely, of course it's being done. And it's just, I think the dentists are catching up to it, especially with COVID. I think people are realizing that they're going to have to find solutions. And so I think that if it wasn't for this, terrible thing, then I think like it would be a lot further away. But I think this will serve as a catalyst where more people will be like, actually, I want to embrace this and see where we're going. But there'll always be people that are just not interested in these models, and that's perfectly fine, right? Because the whole point is to kind of increase access to patients, and patients like this kind of stuff.
Okay, and for example, you are talking about your platform, but we know that it's not the only platform, and you think that many more platforms will eventually.
Of course.
Right. So how does the work? How does financially? Does your business work? I mean, who pays who? I mean, I could understand that in your business you have dentists that work remotely, so that's one way. And you can also have this thing implemented in a specific practice that only the dentists in that practice interact with the patients. How is the financial flow? Where does the money go from? Where does it go?
Sure. So basically, like, if we think about it from like the practice perspective, like the practice can subscribe to the platform, and then what they then do is then they can then promote this to their existing patients, or new patients through their website can connect to them. So they have a page on their website where the patient can do a consult, and then the practice pays a monthly fee, and then per consultation there's a small charge, basically. So what that then means is that the practice can then capture the revenue, and they can also engage with the patient and manage it as much as they want to, essentially, in that way. That's the way that works.
Okay. In terms of data collection and safety and patient safety and privacy, and also especially in terms of data collection, do you think that today data-driven businesses are very looking forward to this sort? I mean, how does the data that you collect can eventually improve oral health and dentistry, and how can that serve as a business?
So the thing is, every time a patient does a consultation, they have then a digital consult stored, and then their episodes of their photos of their condition at that time is stored. So then over time, you can track and build a history that, okay, the gums have deteriorated, the teeth have deteriorated, the rate of tooth wear has increased, erosion has increased. So patients are happy because if someone said, how were your teeth 2 years ago, they could show them, right? They could actually show and send and share that information. But at the moment, all this information is lost. Every time someone does a physical exam, that information is nowhere, right? You're typing up complaining of extraoral, intraoral, that's medical legal. That's not actually quantification of the person's health. Through this, you can start to actually understand and quantify how people's health are over time and provide guidance, because a lot of home care and a lot of prevention you can do to prevent things getting worse.
Okay, so before we end and if someone has some answers, first of all, I would like to thank you, Aalok, for being exposed to, because I know that during the last 5 years, you have been a pioneer, and I'm sure that you really have to be very thick-skinned in order to be able to push through the limits of dentistry, because I know many dentists, and I know how stuck we are in our head, and I know that we are always very afraid of embracing new stuff. And I know that even if people they don't agree with this or that, I think that people today are forced to accept some things. And again, like you were saying, it's a continuum. I mean, you don't have to adopt everything. You can eventually adopt a small part. But I think that the message that you leave us here is that feel comfortable with what you are saying, with what you are doing. And if teledentistry is something for you, then great. If it is not, then great as well, right? What would you say to that?
Agree, and it unlocks new possibilities. Like, let's say you're an associate, you could actually, you could actually build a digital list, right? You could start registering digital patients, rent a room when you wanted to, and then do treatments there. You know, I think we are in this information-centric world. It's not going backwards, right? So the simple question is that you can join at what point you want, to what extent you want, basically, right? You know, and some people might be happy with certain things and other things.
I remember, sorry, Aalok, I don't know if it happened the same, but it's like Uber. Uber in the beginning, there was a big problem, like violence with taxi drivers and stuff like that. But the thing is that most people now prefer to use Uber than a taxi driver. Why? Because there is what we call transparency. Actually, this is the reason why we developed Make Me Clear. I mean, me and Aalok, we developed Make Me Clear. And the reason for Make Me Clear, which is basically like a treatment presentation platform, is because we understood there was a lack of transparency in dentistry. And the same thing from Uber and taxi drivers will eventually happen in dentistry. And of course, that initially, this will be very uncomfortable for dentists. The thing is that if you want to take part or if you don't want to take part, and I believe it's better to use something that is working with colleagues than with someone that is not even a dentist and is doing like co-diagnostic treatments, who knows where and based on what knows algorithm, of course. And so I'd like to thank you very much for being so brave in dentistry, because I think that that your path is not understood by most of dentists. I know that, I'm absolutely sure about that. But for the most open-minded dentists out there, what if you were a young dentist now? I'm going to give you two possibilities. Number one, you are like a dental freak like me. I mean, you like to do hands-on, like you like to do publications, you want to do high-quality dentistry, so you want to practice with your patients. And number two, you are more into business like you are. If you were recently graduated, and by in your story, basically what you wanted to do, you studied medicine, right?
Yes, I started off that I didn't want to be a doctor.
So you studied medicine. So basically, when I met Aalok, he was studying medicine, and then he changed to dentistry. And the reason why he changed to dentistry is because he basically wanted to have like a bigger impact, because he believed that dentistry would have the biggest potential for that. Is that so? So how do you see a young dentist today, Aalok?
I think the best thing is to focus on your skills and become really good at diagnosing, right? The number one skill is being able to diagnose, treatment plan, understand like the cause of pathology, the things that can be modified, and be able to treat plan in a long-term way, so you can understand what treatments will be needed, because dentistry will fail, everything will fail. So I think as a young dentist, get good technically, good at your skill, choose an area of interest that you like doing, and then find ways to then do more of that, basically. So if you really enjoy ortho, find a way to do as much ortho as you possibly can. If you like a way to do implants, find a way to do as much as you can. And the way to do that is by engaging with more patients. So using technologies like this can simply enhance and accelerate your experience, right? Because if you're trying to build your practice or your portfolio in implants or ortho or smile makeovers or, like, for example, perio, whatever it is, you can engage with more people. But the nice thing with this is you can literally have a pocket clinic, right? And then you can kind of like start to decide, do I want to open my own physical practice or not, basically.
And Alessandro, I think that we have some final conclusions even before we go for the questions and answers. I'm going to unmute you. Can you just provide us some final conclusions, and then we go for a quick questions and answers, if there are some?
Well, I think we already have talked about the conclusions, what the future is. I think everybody should go into this, inform themselves, and take this as a new opportunity. Again, leave your comfort zone. So many colleagues around the world, I'm not talking about the young ones, but the established ones, they don't really want to change. And
Yes.
I think these days it's time to think about change things, and not only because of the situation we're facing, but this is promoting a little bit the efforts of rethinking certain modalities, certain things you are doing, even without knowing why you are doing them. So it's time to change. This is my statement.
Yeah, I think that even for people that are very reluctant to this, and I know that vast majority are, I think that my advice would say, look what's happening at Uber. Look what's happening in deliveries like Uber Eats, Uber drivers. Look what is happening worldwide on booking. I mean, the largest booking company, the largest hotel companies, does not have any hotels, and they are probably making the most money, which is booking. I'm not saying that dentistry should be completely unhumanized. I'm saying it's the opposite. It's because by using some of these platforms, you are actually increasing the transparency. And if there's something, and I am 40 years old, I'm sure Alessandro is a little bit older than me, not too much, but I think that's one thing that we have learned over the last years. Even with the technology, there's one thing that people understand, that people want. Being ethical, being trustworthy, and being transparent. People will give more importance to these things than your technical abilities. So being ethical, being trustworthy, and being transparent is something that, in my opinion, technology may play a bigger role, because sometimes you are in a good day, sometimes you are in a bad day. And when you use some sort of this technology, this will force you to be ethical, transparent, and trustworthy. Okay? So, so they are asking if the platform will be available in other languages. I was talking to that with Aalok. They have made it only in English for now, but eventually
we will be.
It will be in other languages. So I don't know if there are any questions about this topic. I mean, Aalok will be more than available to talk about his technology and the way that he sees this integration. So if someone wants to talk, if someone wants to come up and also we can also give a voice to them before we close and we wrap up.
Oh, hi, can you hear me? My name is Christina.
Christina Sabal. Okay.
Hi.
Okay, Christina.
Hi, I'm from dental practice. Hello. Hi. Called SDS. A few questions. Thank you very much. First and foremost, very, very interesting and very forward thinking, and for having the courage to actually break the ice with this in the UK. A few questions. Firstly, is your product certified? Do you need to have certification? Or, like you mentioned something about the NHSX. Second, do the dental practices, if for instance we want to implement this platform in our dental practices, do we need to have any form of certification or approval from CQC? Do our dentists, would they need to inform their indemnity insurer? I mean, what would be the implications? Because I know, for instance, with COVID, if you do telephone advice, you would need to inform your insurer. So these are more like on the compliance side and implementation, I mean, and of course, training and so on and so forth. So if you could kindly walk us through the process. I mean, if we want to set it up tomorrow, can we use it for our existing patients as opposed to just new patients capturing? Can we just upload our database, or how would it work like?
Sure.
I'm very practical down to earth.
No, perfect. So let's start from the top down, okay? So obviously we have people on this webinar from different countries. All countries are different and there are different policies and stuff. You asked about the UK. So let's look at dental protection or other indemnity providers. They have made their briefings quite clear, actually, that like as long as you're treating a patient in the UK or even a patient from the UK that's trapped abroad or something like this, you can communicate, you can work with them. Dental protection actually is the same policy, you don't have to change anything. So I would encourage you to go to the teledentistry page on a lot of your insurance websites. They all have them pretty much, and it actually clarifies. Okay, it clarifies all the details of that. And they're quite helpful, actually, because they understand what can be going on. In the UK, for information governance, they tend to defer to NHSX. So that is like where it's kind of like setting what digital standards can be for anything. And they've already said that Skype, Zoom, and different things like this can be used. So they're fine with different tools as long as it's secure and it's used for the purpose of what it's required. What you have to understand is that this is no different. Well, it's just an augmented way of having a phone call with a patient, right? So you still maintain your record keeping and do those different elements in that way. In terms of like what you're doing, a dental practice is regulated to provide, diagnose different elements and then also provide treatment for that. So this is just a function of accessing and expanding what it's already doing in that way, basically. But like I say, all countries kind of work differently. Asking about connecting databases, you don't connect any database to this, basically. So what happens is patients, as and when they do digital consults, they put their photos and information into the platform. And then as the practice, you can access all that information, basically. It's the property of the patient, it's their records, they can access it and kind of go from there. So I hope that kind of like clarifies a bit, like with the kind of overall kind of like feel of it.
One more question. So do you have like an open API, or does it work, because you said it's augmented, if we have SOE, for instance, I mean, the information that's captured in your portal or application rather, is there a possibility to import that data into the patient notes? Because essentially it's a clinical evaluation.
Of course. So we made it like, so there's hundreds, if not thousands of different dental systems out there, right? So like what we've done is we've made it in a way which is simple for them to be able to like export information. You can like put because our system is report based, you create a report for that situation. You can upload the report into your portal as well, into your SOE or whatever you want. And it's got all the information within there. So yeah.
Do that manually, or would you have an open API?
No, it's done manually, so it's secure. So like, so it's done that way.
By the way, Christina, let me just give my opinion on that. We had a project that's called Make Me Clear, which is like a software an online software that runs on its own, and all the customers from. So it's called Make Me Clear. It's a different thing. It's a treatment presentation software for dentists to use. And most of the inquiries from the US and UK, they all ask for the same thing. Can we integrate this easily with our own softwares? Because that's what people want. How about an API? The problem, Christina, is that the 10 most success that in the US, there are, I would say, 10 to 20 different softwares. So it's almost impossible to do an API for a specific one, because what that would mean is that we will only focus on one software, because unfortunately there is no consensus in terms of the dental language. That is the big problem, and that is something that we face, and I'm sure it will face on Instant Dentist. So these platforms and Instant Dentist, they run independently, and if you want to integrate it, you have to do that manually. So that's.
But this is like information before the clinic, and then you've got the clinic appointments afterwards.
Yeah. I think if you talk about the NHS, if you already start NHS practices, you've got like SNOMED and you've got the standardization of data, but it's not so much standardized for dentistry, really. It's more like for GPs, right?
Perfect. No, thank you.
Okay, thank you very much.
There is a question from Patricia. Patricia asks, I think that we have asked this question, do you think that this approach could adapt to a Portuguese crowd? What do you think, Aalok? You know the Portuguese now. You live in Lisbon, by the way, right?
Correct. No, you can adapt to anywhere.
So basically, so just the background. So once you develop your business, you came to Lisbon. What was the reason why you came to Lisbon? Was it because of the Brexit? Was it because of the Web Summit? Because of there was this everybody. Portugal was like the fashionable place to be here. How did that went?
Yeah, no, combination of factors. I think like with Brexit, and then we always knew that we were going to be like working like globally, and at the same time also Web Summit is a big technology conference here, and I've been to visit Portugal many times because obviously we're great friends, and I saw it's like a brilliant place, and yeah, it's a great place. But this is applicable everywhere. So in terms of localization, like for example, even as it is now in English, if a patient has Google Chrome and they have Translate already set up, it's functionable straight away in Portuguese, basically, right? So it can function anywhere. Might be a bit more Brazilian Portuguese the way Google does it, but I'm just saying that like it can adapt to everyone in a really simple way.
And by the way, being in Portugal, because I know that we have a lot of Portuguese attending here, what's the good thing about the Portuguese in terms of profession? I mean, you have a lot of employees that are Portuguese. What are the good things that you found here in Portugal, and eventually what do you think could be improved in terms of the political environment, in terms of the bureaucracies? How do you find it coming from the UK? What are the good things and the bad things about here?
I think you've got very talented people here. You've got very advanced universities, very high standard of education, all these different elements. Also, it's a wonderful place to live, not much commuting. All these things are great. The one thing I would say is like some bureaucracy with importing is a nightmare, basically, right? So like trying to get anything through customs is a complete nightmare. But I mean, all countries have their things essentially. But no, it's a wonderful place, basically.
And I have Paulo Pacheco. Paulo Pacheco is trying to do Paulo, you can talk. You have a voice now?
Yeah, just a second to try. Oh, the voice. Okay, perfect. Hello, congrats for all the project.
Thank you.
And I'm asking about the platform that we can use in the lab. It is possible to use in the lab some extent of this platform or not?
I understand. So the question is like to communicate with the patient, with the practice more, isn't it?
Yeah, with the dental lab, because we have a lot of information, STLs, a lot of photos, videos, and how we can incorporate in that platform all this information.
Okay, so I think what you could do, like for example, let's say a patient had made a set of retainers or something like this, right? And they've had that kind of like sent to them. The practice could or the lab could provide the STL file of like the 3D model of the teeth, and that could be stored in the patient's record digitally, right? And then let's say, for example, the patient lost their retainer, because they will at some point, right? Then what could happen is the practice could then contact the lab directly with that STL file again, or whatever it is, and you could manufacture it and send it to the patient, and the dentist can do the digital check-in to say, hey, is everything fine? So it wasn't designed in an explicit like lab dental communication, and there are some great tools out there which like allow digital lab and communication back and forth. But if you've got things which could be going to the patient record for them to access, right, then yeah, for sure you can augment. And then it also means that you can play a part in looking after them if they need new fluoride trays or whatever like that as well, basically.
Okay, perfect. Take it.
Thank you.
Okay. So I think that we have answered all the questions here. I would like to thank everybody I would thank everybody that was present here. We are recording this webinar. We will edit this and then we will make it available. Okay. So again, thank you all. Thank you, Aalok, for coming up. Thank you, Alessandro, for being a host and giving your feedback. And I hope that everybody stays safe. I think that even though we like teledentistry, we also like to be together. And I hope that everything can work out and we can all see each other's live and leave the teledentistry only for what it's needed. Okay?
Perfect.
So bye-bye. Thank you so much.
Thank you very much for everyone. Thank you.
See you soon.
See you.